Uh, yeah, yeah.
Question 1. A client who has received services for several years in a dialysis unit appears for a routine visit. The nurse notices a markedly changed effect and refers the client to the social worker. When seeing the social worker, the client seems detached, self-absorbed, and tearful. The social worker should first assess the clients. Okay, y'all, so in this scenario here, we want to make sure that we are paying attention to first. This is the key word here. So we were to place all of our answer selections in chronological order. We are going to choose the one that is going to best serve our client in this scenario. So let's focus in on some of the most important indicators within this scenario. So we have a client. They have been receiving dialysis for several years. That is so important. So this is nothing new for this client. And he showed up for a routine visit. Now the nurse notices that the client has a changed affect and then says, I'm going to refer this client to the social worker. You as the social worker, you see this client, you're like, he seems detached, self-absorbed, and he's tearful. So what is going to be the first thing that you do? Are we going to assess the client's life situation and recent changes? This is actually a really strong answer. And it's strong because this is a client who's been receiving dialysis for several years and he showed up for a routine visit. So we are going to hold on to this answer selection here. Next, we have compliance with medical care. No, we are going to automatically rule this out because we know this client has been consistent with his dialysis treatment. So we're going to rule that out. Next, concerns about dying. Again, we are not going to assess this first. Feelings about dialysis. No, that's going to be inappropriate because this client has been receiving routine treatments for several years. That's not going to be the first thing that we do. We want to assess this client's life situation and see if there have been any recent changes that have occurred. So A is going to be our correct answer for this scenario. Question 2. Okay, this is going to be a straight recall question. I say recall because I look at my answer selections and I see alcohol, marijuana, cocaine. I automatically know this is going to be a question that's going to test me on different substances. So let's read into question 2. A man is seen in the ER with complaints of visual hallucinations, confusion, and restlessness. He also has chills, dilated pupils, and nausea. He says, "Nothing is wrong, I just need sleep." Which of the following substances is most likely the cause of the condition? So this question is asking us about a substance and it says what is the most likely cause of the condition. So what is this client experiencing? So we have visual hallucinations, confusion, restlessness, dilated pupils, and nausea. And on top of that, the client said, "Nothing is wrong, I just need sleep." So when I go to my answer selections, I am going to automatically rule out alcohol. I know this is not going to be the correct answer given that this client is experiencing visual hallucinations, dilated pupils, confusions, and sleep. Next, we have marijuana. I'm also going to rule this one out because those are not the side effects of marijuana. So, by process of elimination, I know that the correct answer is going to be C, cocaine. This is a stimulant. And when you look at the symptoms with the confusion, the restlessness, the lack of sleep, the dilated pupils, we know these are all side effects of cocaine. Question 3. The treatment approach in which the client's dysfunctional behavior is corrected through the use of learning theory is. All right, y'all. So we got another recall question. In this one, we want to make sure that we are focusing on a treatment approach in which the client's dysfunctional behavior is corrected through the use of learning theory. So if we look at our answer selections here, we have A, client-centered therapy, B, transactional analysis, C, behavior modification therapy, or D, ego analytic therapy. The correct answer to this one is going to be C, behavior modification therapy. This is a recall question, you all. So B.F. Skinner demonstrated that behavior could be shaped through reinforcement and or punishment. Behavior modification is a method used to replace negative behavior patterns with desired behaviors or promote behavior change. So when we look back into what this question is asking us with the corrected behavior through the use of learning theory, C is going to be the correct answer. Question 4. A 16-year-old client is seeking services from an outpatient social worker after becoming the victim of sexual assault. The client's mother has signed a general release of information that allows the social worker to talk to the school. The social worker receives a call from the client's math teacher who states the client's grades have declined and she wants to know if there's something going on with the client lately. How should the social worker respond? Okay, so in this scenario, it is asking you how you should respond to the proposed situation that's going on. So let's focus in and look at the beginning of this scenario. We know we have a 16-year-old client who is seeking services from an outpatient social worker after becoming the victim of a sexual assault. Now, the client's mother signed a general release of information that allows the social worker to talk to the school. The social worker receives a call from the client's math teacher who states the client's grades have declined and she wants to know if there's something going on. How should you respond? Well, we know that we are working with an adolescent client. The mother signed that general release of information for you, the social worker, to talk to school personnel, in which you have this math teacher who's called and says, hey, the 16-year-old's grades have declined. Is there something going on? How do you respond? Do we do A, contact the client's mother to determine how much information she's comfortable with the teacher knowing? No, we are going to rule this one out because we already know, based on in this scenario, a general release of information has already been signed, and this allows a social worker to talk to the school. So we are going to rule A out, not the correct one. B, contact the supervisor before disclosing any information. Again, this is going to be incorrect because we have that release of information document. C, talk to the client about whether or not she should want any information disclosed and the possible implications of disclosing information. Okay, let's hold on to this because that's a pretty strong answer. Or D, tell the math teacher that the client was sexually assaulted. When I look back at C and I compare it to D, I am going to rule D out and I'm going to go with C because it is appropriate to discuss with the client whether or not she wants her teacher to be made aware of the assault, and she should be warned of the possible implications that could occur after disclosing that information. So C is going to be your best answer selection. Question 5. A family has adopted a 7-year-old boy who had previously experienced severe neglect. The adoptive parents are meeting with the social worker because they are frustrated that he continues to hoard food. They report that they often find food under his bed and he steals extra food to put in his backpack for school. What recommendations should the social worker make? So let's focus in on some of our key indicators in this scenario. So we know we have a family who's recently adopted a 7-year-old boy who previously experienced severe neglect. The adoptive parents are meeting with the social worker because they're frustrated that he continues to hoard food. They said that they find food underneath his bed and he's stealing extra food to put in his backpack for when he goes to school. So, as a social worker, what is going to be your recommendation to this adoptive family? Is it A, the parent should take away privileges each time they discover that he is hoarding food? No, that is not going to be the best thing to do in this situation. Why are we going to punish this 7-year-old child who's already experienced severe neglect? That's not going to be the answer. B, they can provide the child with a food basket where he can keep his healthy snacks and they can refill the basket when it's nearing empty. Okay, this may be the answer, but let's hold on. Let's not move too fast. C, the parent should ignore the behavior as it will likely go away on its own once the child realizes that the family has plenty of food. No, we are going to rule this one out, because if that's the case, then the 7-year-old boy, he wouldn't continue to steal extra food and hide it underneath his bed and store it in his backpack for when he goes back to school. So C is incorrect. D, they should install locks on the cupboards and the refrigerator so they can better monitor his food intake. Again, no, this is not going to resolve the issue at hand. D is not the correct answer. So B is going to be the one that we are going to select, because we are supporting the child and helping him learn that he will not go without food. And food is important in helping him overcome the neglect that he experienced. So B is going to be the correct answer. Question 6. A social worker is conducting an initial assessment with the client. What is the best way for the social worker to inquire about the client's sexual orientation? All right, y'all, so let's focus in on this one. So we are a social worker and we are conducting an initial assessment with the client. Initial lets us know that this is one of our first encounters with this client. And as a social worker, we are trying to figure out what is the best way for us to inquire, to ask about the client's sexual orientation. Are we going to say, do you consider yourself to be gay or straight? No, we are not going to do that. A is going to be incorrect because this is a limitation. What if the client does not identify with either one of those? A is incorrect. B, what is your sexual orientation? Okay, this is very open. Let's hold on to B. So far, so good. C, are you attracted to men or women? Again, this is not going to be the correct answer because this is kind of in congruent with A. Do you identify yourself to be gay or straight? D, tell me about your sexuality. Okay, so this is a open-ended question. However, it's limited because it only focuses in on your sexuality. And the scenario here is asking about a client's sexual orientation. So I'm going to rule D out. And B is going to be our correct answer. So with us saying, what is your sexual orientation? This question is asked in a non-judgmental fashion, and it is the most effective way to encourage a discussion about sexuality. So B is going to be the correct answer. Question 7. A couple requests help in improving their 7-year marriage. When you ask them about their goals, they begin to argue almost immediately. The husband states his wife nags him too much about chores. The wife states her husband is lazy. How should you proceed with establishing treatment goals? Okay, so in this scenario, our focus is going to be on How do we as a social worker establish treatment goals? So let's go back into the scenario to figure out what's going on. So we have a couple who's came to you and they say, you know what, we need help with improving our 7-year marriage. When you ask them about goals, they argue almost immediately. The husband states his wife nags him too much about chores. The wife states her husband is lazy. So we have two conflicting points here. So how do you as a social worker establish effective treatment goals? Is it A, recommend that they each attend sessions with you individually to set separate goals to work on until they are ready to work together in a session? No, this is not going to be the correct answer. And this is incorrect because this is a couple who's presented together because they both want to improve their 7-year-old marriage. By separating them, we are not going to help them accomplish that goal. So B, assist them in setting a goal to help them resolve their arguments around household responsibilities. Maybe, but not really. And I'm going to tell you why. Because B, it only focuses on household responsibilities. It does not focus in on everything else that they have going on. So B is going to be incorrect. We are not going to choose this one. C, assist them in establishing treatment goals to help them learn to improve their communication and resolve conflict. Oh, okay, so this may be the answer, but let's hold on to it because we still need to review D. So D says, recommend they receive individual treatment to help them work on individual issues. No, we are not respecting them as a couple. Working on them individually is not going to help the couple improve their 7-year marriage. So C is going to be the correct answer in this scenario. And it's correct because it helps them learn new skills that they can address the problem of disagreement over chores as well as other problems in their relationship. So we like this because we are going to focus in on improving communication and resolving conflict. C is the strong answer. Question 8. A social worker is employed at a doctor's office. The program director, who is a doctor at the office, reports that the office will be providing services via video conferencing to established clients who live in rural areas. The purpose is to increase access to services for clients who lack reliable transportation. What should the social worker do? Okay, so what is going on in this scenario? We need to highlight some key indicators. So our role is a social worker who's employed at the doctor's office. Now, the program director, who's also a doctor, comes to you and says that the office will be providing services via video conferencing to established clients who live in rural areas. And they want to do this because they want to increase access to those clients who have or who lack reliable transportation. So you have this program director who's presented this information to you. As a social worker, what is going to be the next thing that you do? Are you going to A, inform the program manager that social workers are not allowed to provide telemedicine? No, that's going to be incorrect because if we look back at our code of ethics, we know that as a social worker, we are allowed to provide telemedicine services under certain circumstances, right? So we're going to rule this out. B, explain to the program manager that social workers cannot establish therapeutic relationships with clients when clients are not physically present. Again, this is going to be incorrect, and it's incorrect because of this word, this phrase here, cannot establish therapeutic relationships when clients are not physically present. That is incorrect. So we are going to rule this out. C, begin services with clients who have already begun receiving service via video conferencing with the doctor. No, we're not going to choose this one either, because we're only going to select those clients who already have experience with the video conference, and we're saying forget the other ones who don't have that experience. So C is going to be incorrect. All right, so process of elimination tells me D could possibly be the answer, but let's look. Discuss with each client the potential risks, benefits, and consequences of receiving services via electronic media. Yes, y'all. This is going to be the best thing that this social worker can do. We want to discuss the risk and potential consequences with clients so that clients are aware how services will be delivered via electronic media and how they're different from a face-to-face encounter. So we always want to make sure that we provide our clients with all of the information up front and let them know so they can make an informed decision. D is going to be your correct answer. Question 9. The following version of the DSM eliminated the multi-axle system to present a more simplified approach. Okay, this is a straight recall question. So we are going to be looking for the answer selection that eliminated the multi-axle system to present a more simplified approach. The correct answer to this one is going to be C. The DSM-5 was eliminated. And the reason for this is because this version of the DSM received so much criticism because of the lack of reliability and consistency amongst other clinicians when it came to diagnosing a client. So C is going to be the correct answer here. All right, change agents, this is our last question. Question 10. You are an outpatient social worker and your supervisor has asked you to provide treatment to a couple who was found guilty of physical and emotional abuse against their 4-year-old daughter. What is your primary task during the initial session with the couple? Okay, so let's focus in. What is our role here? So you are an outpatient social worker and your supervisor asks you to provide treatment to a couple who was recently found guilty of physical and emotional abuse against their 4-year-old daughter. What is your primary task during the initial session? So initial, first, primary. What is going to be the most important thing that you are going to focus on in this first session with the couple who was just found guilty of physical and emotional abuse against their 4-year-old daughter? A. Discuss the couple's concerns and their feelings about why they were referred for treatment. Okay, so let's hold on to this. This is not a bad option here. So we're going to hold on. B. Strongly encourage the couple to take full responsibilities of their actions. No, we are going to rule this out. That is not going to be our primary task when we're first meeting with this couple. We're not going to say, you know what, y'all need to take full responsibility. Y'all was physically and emotionally abusive towards your 4-year-old daughter. No. C. Assess their motivation for treatment and decide whether the children should return home. Nope, this is also going to be incorrect. You cannot decide if the children are going to return home. And the reason you can't is because you are an outpatient social worker. That is not in your role. D. Explore reasons why the couple may have engaged in such unacceptable behavior. Okay, so if you want to be a little nosy, this would be the correct answer. However, this is not going to be the first thing that we do. Is not our primary task. So we are going to eliminate D. A is going to be the correct answer. You should also explore the couple's feelings about being referred to services, which may involve resentment or some anger towards the overall agency. And during the initial session, your task is not to encourage the couple to take responsibility for their actions. And if you were to do this immediately, you're going to jeopardize the possibility of having a positive working relationship with the couple, because you're going in automatically accusing them. So we want to discuss their concerns, discuss their feelings. We want to know, are you upset about being here? Are you happy that you're here? We want to assess that first. So A is going to be our correct answer.